Hi, my name is Michelle Turner with Movement Lesson, and this note actually is to professionals, meaning doctors, other therapists. Many of you don't know I'm a mom first. My son has special needs. I've come a long way from looking at mitochondrials, muscular dystrophies. He ended up having Haemophilus influenza. It destroyed his vestibular system for many years. He wasn't seeing properly or hearing because of where the infection was. But being a mom and also being a therapist, I see it from both ends. I think people need to take time and just think about what they're saying. First of all, parents aren't professionals. This is a whole nother language we have to learn of medical information to do with the disabilities, our system, whether it be access or whatever kind of acronym we're using in the state we're in, because every state uses a federal funding differently. So just because a child's getting services in California that pertain to this, that, and the other, they might not get the same services in Utah. The work that we have to do as parents, because like in Arizona is a right to know state, so unless you have a right to know it, they don't, someone doesn't come with me with the menu saying, oh look, there's a whole bunch of services that are available to you, you pick and choose. If you don't know that the Foundation for Blind Children helps all children that are visually impaired where it affects learning, then you might miss that opportunity for your child to get visual services, even though you have a diagnosis. So it's a lot of work that we go through as parents. It is even harder when a professional might not be listening. I realize that you're busy. I realize that you've got 15,000 patients. Take the time to realize that just because this child might present really well, even though they have a diagnosis and for their condition, and the mom should be grateful. We're all grateful. However, if a child, I don't care, and this is why I haven't given up on adults either. I was only going to work with children with special needs, but adults, especially of age, get treated the same way. Welcome to old age, shot, pill, surgery. What can I do? Oh, absolutely nothing. Take this pill. That's not the way it should be. People need avenues of directions where they can at least try. There's nothing wrong with trying different things. And that could be with medication, that could be with surgical options, and that could be with different therapies. No two children are the same. No two adults are the same. No two doctors operate the same, or therapists. We all have our ways of how we present from our life experiences to that person. However, to sit there and look at someone because they're maybe not as severe, they're not on oxygen, that they don't have those kind of conditions associated, even with, like I said, if you're a specialist in a certain diagnosable area, the parent has a right to expect things that their children can improve. They have that right. Don't take it away from them. You really have to watch sometimes what you're saying. If they want more for their child, take the time, and if you don't have the time, look at avenues or give them directions, possibilities where they can possibly go. Listen, I'm not sure if this will work for you. Tell them that. It's okay. However, I've found some successes with you might want to try this. That's great. People think the reasons why I got into this work was because of my son. Partially. My son was coming out of anesthesia. There was a young little couple down from Flagstaff, third little baby, 8 months old, is coming out of anesthesia. You have no idea. Again, the child's coming out of anesthesia. It's probably the first surgery they've ever had. They're not used to being in the medical surroundings. A social worker walks in, blah, 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 blah. Your son is basically deaf. 80% hearing loss in one, full hearing loss in the other. Here's a pamphlet if you have any questions. Have a nice day. It's like a Charlie Brown movie. At that time, it's just like, what? You don't hear what you need to hear. You can't process the information. You're in outpatient surgery. You're trying to take care of your child. You're hearing this it's devastating. And this just can't keep going on. And so as parents, think about, if you don't know how to present for your child, do what I'm doing. Take a small videotape, because they always act so much better or so much worse in a doctor's office, depending. but they never show what your concerns are. Videotape it. iPads are always better because the video plays larger, but just show the doctor, my child breathes like this going to sleep. Is there something I can do to have the child more comfortable? Or I don't understand why my child is doing this, instead of trying to explain it. So it's just you're there, and take the time to look at it. And if you don't know, that's fine. You might not know. I don't have all the answers. Nobody does. But allow for that opportunity. Say, listen, I'm not really sure. Can I have a copy of this? Can I go consult? Or maybe you want to see such and such. And that's great. But you have to really, it's not like, hi, I'm sorry, your child's autistic. I'll see you in 6 months. What do I do? Oh, you can call social whatever, but right now this is just all I do. I'm doing the diagnosing. But that's not an avenue for a parent, and that's not how a parent's going to be successful with their child. Or what's worse is telling a parent to wait that 6 months or that 3 months. They're sitting home. They can't, let them do something. Yes, a lot of parents maybe don't want to do something, and that's fine. Or they want to wait for the diagnosis before they do something. I prefer to be proactive. Why not work at the brain when it's 6 months old versus a year and a half? You've already missed a year of opportunity to change the brain situation, to actually look at a different opportunity of learning. But this whole, well, until your child's diagnosed, then you can't get services. Maybe they want a private pay. Maybe they don't want a private, but let them have their options to do so. Don't assume for them that until they have certain opportunities to get these kind of things. Right now in the state of Arizona, your child has to be 50% delayed or greater to get early intervention services. That's unacceptable. That's a huge 50% delayed for a 1-year-old. The opportunities that are missed or being missed by that central nervous system is just huge. And then on top of that, you can only have autism, epilepsy, cerebral palsy, or cognitive impairment to continue those services beyond the age of 3. Too many children are getting slipped through the cracks. Too many children are not getting services that they need, and that's fine. But you have to allow the opportunity for the family situation to rise to the occasion instead of to falter. And so again, just take the time, realize just step back. How are you presenting yourself to the parents? Are you using terms that are just above them? Especially if the parent, where English just isn't their primary. Yes, they might be capable of understanding English. Medical English is a whole different animal, even for the layperson. So is there a way that maybe you're not explaining it, or can you give these informations to the parent and then have them talk to your PA or something? Let the PA get that kind of assistance of taking a person into the side room and, do you have further questions? What can we do to incorporate this into your family life versus it being a situation where you just don't know what to go about. And that's why parents just rely to the internet, because they're not getting the answers that they're doing from the medical facilities. So again, it's just, it might take a little extra time. It might not. Maybe it's just editing. So just think about it. How are you presenting yourself to a client? And if they look like they've just been a deer in the headlights and they're looking at you like something's being missed in the translation, and see what you can do to allow opportunities. Because remember, the human brain is not in limbo. We're either thriving or we're regressing. Brain just doesn't hang out. So, and that's the same with the family situation. So give them the opportunities where everything can start thriving. Because I don't care what the genetic condition is, how rare it is, where the child, maybe the lifespan isn't as great as you'd like it to be, whatever it is. The human brain, if presented properly, always wants to learn. That's the function of the brain. It wants to learn. And I don't care, you could be 70 years old, it wants to learn. So allow those opportunities where the learning can occur versus, I have this, I'm a goner. So it just take some time and think about how you're being a professional. Thank you.